If you will be getting chemotherapy, you may hear the words regimen, course, and cycle. Let's define those three words. A regimen is a choice of a chemotherapy drug or multiple drugs given for specific amounts of time. Based on the stage, type, and location of cancer and a patient's general health, a doctor will pick one or more medications to be given at the same time to treat the cancer. The dose of each drug, how often the drug is taken, and how the drugs are given are also important pieces of information. All of this information together is called a chemotherapy regimen. A chemotherapy cycle is the time it takes to complete one treatment with the drugs that the doctor picks. Based on the types of medication, that can be hours, days, or weeks. If two drugs are chosen by the doctor, the first drug given on Monday and the second given on Tuesday and Wednesday, the cycle length is 3 days. After a cycle of chemotherapy is complete, the body needs to rest and recover. So many chemotherapy regimens have multiple days between cycles. Most cancers require multiple cycles of a chosen regimen of chemotherapy drugs to complete the treatment course. A course is a series of chemotherapy cycles. Because chemotherapy cycles can be weeks in length based on the choice of medications, a course can last for months. For some cancers, it is possible that the full course of chemotherapy will be interrupted by other treatments. A doctor could prescribe 3 cycles of a regimen of chemotherapy and then do a surgery, and then follow up with 3 more cycles of the regimen of medications. When a course of chemotherapy is interrupted in this fashion, the cycles given before surgery are called neoadjuvant chemotherapy, and those after are called adjuvant chemotherapy. Sometimes, when a regimen is chosen by the doctor and the patients begin treatment, a change in therapy might be necessary. Different people can react very differently to the same medications. When this happens, doctors may decide to change the chemotherapy dose or give patients additional medications to prevent reactions to chemotherapy and sometimes change the length of time between the chemotherapy cycles. Occasionally, a chemotherapy regimen is changed altogether. In patients where a cancer recurrence happens, they might require a new round of chemotherapy to treat the disease. In some cases, the same regimen is given again. But if a different regimen is given, that is called a second line of chemotherapy. The next regimen given to treat the cancer would be called the third line of chemotherapy, and so on. There have been many advances in treating the side effects of chemotherapy, but it's not an easy experience. If you are about to start a treatment plan, or if you are currently being treated, remember to communicate to your doctor's office about how you're feeling. Seek the support of your friends and family, and be kind to yourself.